And welcome back. Well, as we age, our cheeks lose volume and our bone structure changes a little bit too. In the effort to look and feel younger, there are things that you can do to get a little lift back without surgery.
So why do we have a surgeon with us today? Dr. Mary Fox is an ear, nose, and throat surgeon, now seeing patients at the Wisconsin Vein Center and MediSpa alongside Dr. Deborah Manjoney, who's been a regular guest of ours. Nice to have both of you here this morning.
Thanks for having us.
And there's a reason why somebody with Dr. Fox's expertise is great for the work that you do at the Wisconsin Vein Center and MediSpa, right?
Absolutely. She really understands the whole anatomy of the face. And so, and she sees patients of all ages, and so she's able to understand what the face, how the face changes. And so it's great to have Mary there so we can have a nice natural approach to rejuvenating.
Well, and that's part of your training as an ear, nose, and throat, is that you have facial plastics. Is that what you said?
Yes, it is. It's part of our training and part of our board certification.
Yeah.
So specifically as it relates to injections and fillers and things that we can do to have a more youthful appearance, what are you doing specifically, and how does your training help you to give people a very natural look?
Well, there's lots of areas of the face that we focus on. So just how the face ages, we're losing a lot of fullness in our mid-face, kind of droops down a little bit. The anatomy knowledge is more the anatomy of where the nerves are, where the vessels are. So I feel a little bit more safe doing things that nurses might not feel comfortable doing. Going more medial to where some of our nerves come out, where the nerve bundles are, where some of our veins are. So filling in the areas underneath our eyes where we get a little bit of droopiness as we age, which can be a little bit of a touchy area to practice in. But then just trying to get that natural lift in the mid-face and looking less like we've had a lot of stuff done.
Yeah. Some of these before and afters speak volumes for what you're doing and what you're saying, that you really understand how the face ages. It's not only our skin. Describe kind of how our structure and bones change too.
So our skin changes. We stop making collagen when we're in our 20s. We have fat underneath our skin, and gravity works with that fat and pulls all that fat down. So instead of having that nice mid-face fullness that we have as we're young, we start to see more of that fullness down in here, and we get some of that jowling. We also lose some of our bone structure as we age. So that again leads to that loss of the mid-face.
So we see a flattening of the cheek, especially in the mid-face. And what we're trying to do now with fillers, instead of just doing a facelift type of thing where you just tighten the skin and leave somebody with old-looking skin and age spots and a very taut appearance, we're actually putting back volume to make somebody look more youthful. And often you don't need a facelift if you're going through these things.
How do you know what to ask for when you visit? Because I think they're different products. I mean, we've heard about Botox. We know what some of the results are, how long it lasts. How do you know where you need a filler, where you need Botox? You're not quite sure what it would take to have your face appear more youthful.
When we have the patients come in, we always sit down first, give them a mirror. We look at things together, and I say, what bothers you about your face? What do you see? And then I'll typically tell them what I see, and then we talk and make a plan. And there's lots of different fillers, and different fillers are meant for different places. We have a new exciting filler that came out, Voluma, which is a filler that we use more in the mid-face. We use it deeper, and we're doing a lot more of that where you do it in the cheeks, and you'll see a natural lift to the lower face and end up using less down in the lower face. So we go through that. It's a process that we go through with each patient individually.
So would Voluma replace something like a Juvederm?
No.
No, they're different.
Not necessarily. Now, Voluma will last up to 2 years.
Oh, wow.
And so it's wonderful, and this is the longest lasting filler that is available. But it's really approved for the mid-face. We like to start in the mid-face and work our way in, starting at the sides, and really almost rebuild a cheekbone for somebody and give them a little bit of volume in their cheeks. And that tends to lift up the fold here that used to be filled so much with Juvederm. So that not as much of the other fillers are needed. But very frequently we'll use a filler that doesn't last as long because it's got a little bit different viscosity or strength, so that it's better to use a softer one perhaps in this area, whereas the deeper ones going right down next to the bone, we can use something like Voluma.
No, so in some of the especially dramatic before and after pictures that we just showed, are those things that happen in the course of one visit? Does it happen with several treatments over time?
Typically you can do it in one treatment. So it's a remarkable thing. What I like to do is have people bring their cell phone, take a picture of them. We take pictures as well, but take some pictures before, do what we're doing, and take some pictures afterwards. And people are amazed because with fillers, you see the results right away. So you have a complete different appearance. And
Your
sometimes it's fun
selfie
to
can
see.
change in one day. Huh?
Absolutely can.
Is that also something you'd want to bring a picture of yourself when you're younger?
Often we ask people to do that. Yes, brings a picture from 5 years ago or 10 years ago, so we can see what their face looked like. We want them to look like themselves, only better. Back looking younger again.
Yeah, because so often you see people who've done stuff and you can tell that they look
Yes,
different.
yes,
and then
yes.
people are like, well, that looks weird. They look different, and you can't figure out what it is, but it's sometimes not as good. And one of the things that's nice about what you do is you really understand the anatomy. People look better, younger, more youthful, like themselves.
Yes.
Right.
You've got a great special right now for Voluma. It's if you buy one syringe, you get the second half price.
That's right. And so we're going to continue that special through April. We had done it through March, and it's been very well received, and people are very happy with it. And so it's an expensive filler because it does last 2 years. So this is really a great deal to be able to come in and get one syringe, you get the second one at half off, because you usually do need at least 2 syringes to get the filling that we want in that mid-face area.
And you also have the Aging Face Seminar that's going on Tuesday, April 8th, and you do need to RSVP for that, correct?
Yes, they need to call and reserve a spot. And then it's free, but there'll be just a cost for the reservation. So if somebody doesn't come, there'll be a little bit of a monetary penalty, only because the space is so limited.
Okay. Otherwise, they get to use that towards something?
They don't even get charged at all.
Oh, okay. So there's no charge then if you do come. And here's where you can find the Wisconsin Vein Center and MediSpa for the Aging Face Seminar, or to call and make an appointment. They're on Georgetown Drive in Pewaukee. The phone number is 262-746-9088. Remember, you do have to RSVP for the Aging Face Seminar with Dr. Mary Fox. Online, they're wimedispa.com and Facebook as well. Thanks for being here, ladies.
Great,
Thank you for having us.
very
Nice to
much.
meet you too. Thank you.